Hey, this is Chris Dewey with May River Medicare in Old Town Bluffton, South Carolina. And today we're going to talk about what happens when you are working, you lose your job or retire, and you need to begin Medicare. All right, so there's a couple assumptions. I'm going to assume that you're above 65. When you turn 65, chances are you got Part A. Part A costs nothing. You've been paying into it your whole life through FICA taxes. So most folks automatically will enroll in Part A, and you lose your job, let's say at 66, 70, 71, or you retire. You have no other options. Your spouse is not working. What do? Well, what you need to do, you need to enroll in Medicare Part A and Part B. Now, Medicare always begins the first of the following month. So let's a young lady new to Medicare who retired, and she worked for Cigna. She retired on March 31st. That's when her health coverage ended. So she touched base with me in April, early April, April 3rd. What we did immediately was begin the process online for enrolling in Part A and Part B. And so she will start May 1st will be her effective date for both. Well, she's got Part A, but Part B will start 5/1. Part A started with the month she turned 65. All right? So Medicare allows you different times to enroll in Medicare, different time periods. So when you turn 65, that is your initial enrollment period. That's 3 months before you turn 65, the month of, and 3 months after. That's when you enroll in Part A and Part B. And most people that are drawing Social Security benefits, they automatically get that Medicare card sent to them. But you're 66, 67 and a half, 70, you have what's called a special election period. That special election period lasts 8 months from the time that you lose your job. Okay, guys, now the special election period, once you lose group coverage or you retire and you only have Part A, from the last day of your coverage end date. So for the lady that worked at Cigna, her coverage end date was March 31st. Okay? So she talked to me April 3rd, and I said, we need to get you enrolled using a special enrollment period immediately. Otherwise, what's going to happen is you're going to have a lapse in coverage. What do I mean by that? So she's not working anymore between March 31st was her last day. So if she's not working, who pays first? Medicare pays first. Now the problem is she only has Medicare Part A. She doesn't have Part B. If she had to go to outpatient surgery, MRIs, doctor's visits, she's the one who's going to pay first. All right? And her retiree COBRA coverage or supplemental, that's gone. So she is going to pay first. The hospital will be okay. She's got Part A, but Part B, and there's a lot of Part B services that are done in the hospital that she would have to cover. All right? So the big thing that we have to understand is that 8 months, the clock is ticking the last day. When you lose your group coverage, you have 8 months, but don't take your time. You want to enroll immediately so you don't have the lapse in coverage. Because if something happens to her between April 1st and May 1st, she is going to be the one on the hook because she's not working, so Medicare pays first. Well, she's only got Part A, so you get the point. She could have major problems if something happened and she had to go to the hospital. All right? So that's why we want to get Part B coverage immediately, as soon as you know what before you even know when your end date is. You want to orchestrate it so that the company you work for has already filled out the request for employment information, because what they have to prove that from the time you were 65, you had group coverage or some credible coverage through the company, and they have to get a letter, and they'll say her group coverage ended the last day of March. So that's fine. We have that 8-month window, but we wanted to get it done early because she's going to have a lapse in coverage, okay? Okay, guys, so you know when your last day of health coverage is. You realize that you need to have your employer fill out a form. It's the form L564. All right, so if we look real quick, basically your employer is going to fill out name, address, employer, city, your name, social number, and what they're also going to do, that right here it says if you give the date the applicant's coverage began, they're going to write that in there. And basically what they're going to do is they're going to fill that out, they're going to sign it, and they're going to email it back to you. And what you're going to do is either bring this form, it's a one-page form. They just need to know that you were an employee of the company. They want to know when the last day, the first day of your group health plan and the last day of your health plan, all right? And that's it. That's all they're going to fill out and send back to you. And you want them to get that done well before your last day of coverage so that you can enroll in Part B. So you got two ways to do this. You could do it online, or you can fill this out and bring it down to your local Social Security office. In our area, you're going to go down to Beaufort, all right? And you'll just fill this out and give it to them, and you'll also get this from your employer, the request for employment information. So those are the only two forms that you need to fill out to get your Part B. All right, and once we get those, like I said, you can either do it online. I have a video on how to set up a SSA account, how to enroll in Part B. You can do that online, or you can go to the Social Security office, all right? Okay, guys, in conclusion, once you find out when your coverage end date is for your group insurance, when you're either losing your job or retiring and you only have Part A, that end date has to coincide with the Medicare beginning date. So what do I mean by that? You have a special election period that lasts 8 months, but you don't want to wait 8 months. As soon as you know when this end date is, you want to get the CMS form L64, which we just went over. I can send it to you. Or we also, the CMS form 40B, that's your Part B application. You can either do that online or bring it down to Beaufort and have it there, or wherever your Social Security office is. If you're out of state, I'm licensed in 46 different states. So your choice. Now, it's not done. Once we get the beginning date, which will be the first of the following month after your end date, we want that so that there's no lapse in coverage. What we're going to do, then we're going to look there's only two paths you can go down. You can get a Medicare supplement with a drug plan, which is what I recommend, or you can get an Advantage plan where you turn in your red, white, blue Medicare card for a Advantage plan with a Humana ARP. There are many companies that do it, Aetna. And there's another video on that, which you're welcome to look at as well. But that's the steps. We find out when our end date is. We get your employer to fill out form CMS L564. Very simple one-page form. They fill it out, they email it to you. We upload it onto your Part B application. Now, you could just do this all by paper. You could fill these forms out, have your employer do it, and either fax it in or bring it down to your local Social Security office. But that's it. And then Part 2 is, once we get all this done, we're going to look into a supplement, an Advantage plan, or a drug plan. And those are your options. All right, you guys have a great day. Thanks for visiting May River Medicare. Bye-bye.